No mother is teaching their children to be happy herself so that they will be happy by themselves.
When somebody has a fracture at that age, I don't see them visiting a gynecologist because that angle itself is not explored. All they do is go to the orthopedician, get a putty done, and then wait for it to heal and pop on calcium tablets.
And mental wellness is the most strongest point of health. And if you think that you are going to neglect that point, you're utter failure. You become prime minister of any country, you're mentally unwell, you're not the right person for the right post.
Stay with the wrong person, have kids for all the wrong reasons that the clock is ticking, rather than choose this. Find the right person and then have the
That's
child.
why we have an option of egg freezing and embryo freezing.
What is your take on menstrual leave? Hormones. They're the silent puppeteers behind our body, our mind, our mood, and of course, our sex lives. From first period to hot flashes, from baby fever to touch me not phases, they're silently shaping how we feel and how we carry ourselves in this world. Today's episode is for everyone. Women, of course, to know how hormones work in their body, and of course, for men who love women, whatever love that might be. Hello, and welcome to the XnY Podcast on intentions, connections, and intimacy with me, Suman Raju, and my co-host, Dr. Bindu.
Hi.
And today we have a very special guest, Dr. Shilpi Reddy.
Hello,
Thank you so much, madam, for coming.
my pleasure.
And if you're in Hyderabad, you would know that Dr. Shilpi Reddy's time is super precious. She's always on the run, whether seeing patients in her OPD or delivering babies in her labor room, all while dancing along with the mom-to-bees. She's super busy. And also in between all of this, she's empowering women on her social media handle. Again, thank you so much. I can't tell how much it means to us, you giving so much time for us.
Thank you.
Thank you so much for joining us today with our XnY podcast. Before we start and go into any of the topics, I would like to know more about you, and our viewers also would love to do that. During my medical internship days, me and my friends used to fight to assist in a surgery, but when it comes to the labor room, we were like, after one or two, deliveries is like, no, I don't want to do it. But on the other end, you here are pushing people towards it. I would love to know what made you choose to be a natural birthing expert.
So basically, welcome to all the viewers. I'm Dr. Shilpi Reddy and I'm an obstetrician. Basically, I was a very, very passionate surgeon, then shifted my career to IVF. I didn't have the feel for fertility at that time. Somehow I made myself comfortable with fertility, IVF and all that. But as an obstetrician, it always was my passion to go deliver babies. And somehow it came through across my life that I understood that there is a potential for me to become an obstetrician and deliver babies better than an IVF specialist. And over a period of time, what I realized was there is so much of natural pregnancy potential in every couple out there. They would not need IVF or any intervention if they take care of their life, their relationship, and their surroundings. So that way, right now, I practice natural fertility and also natural birthing, because both are the best things that really anybody would want to have in their life. And to build that chemistry, everything else follows, including me, myself, and my career.
It's a wonderful way to put it out, like nature has given you and you can do it naturally.
Yes,
just
correct.
Build the connection.
Madam, for those of us who did not open a biology book, could you tell us a little bit about hormones and how they act in a woman's body?
So basically, woman body is a Pandora's box. So it's highly impossible to understand a woman's feelings, her emotions. But yes, when it comes to biology, when it comes to books, when it comes to the hormones that are going in her body, there are two major hormones and one or two minor hormones. But when it comes to the menstrual cycles, two hormones play a very big role, that is the estrogen and progesterone. And once she gets her period, both the hormones just drop, and then starts the formation of a follicle. Follicle is nothing but an egg that forms in the ovary. Now this egg, when it is forming, there comes the estrogen hormone. Estrogen hormone is bubbly, full of life and full of enthusiasm and happiness, nice good mood, and that cherishable moments and nice happiness that it gets, and that glow on your face, and you want to do something, experiment and all that. So somebody who's having regular periods, the first 15 days are very crucial. There forms a very good egg, and around 14th, 15th, 16th day the egg releases. Now this is the actual time, say around after a week of starting of the period, women would experience very good mood and good sexual attraction, and would want to have good sexual activity in life, and that's the best period that she would go forward. Once the egg releases, that's the peak time when her hormones are the best, and she would want to enjoy sexual life and reciprocate, and also that's the best time when even lubrication is good, and her bodily changes are good, the glow, everything else is the best at that time. So after the egg releases, say around 15, 16, 17 days, something like that, for about 2-3 days, again it's the best time. Once the progesterone comes in, the progesterone is the hormone that releases from the follicle after it has got released. It's a completely different hormone from estrogen. It'll calm you down, it gets you some mood swings, it gets you, different types of eating habits, and all that. It makes you calmer, sometimes irritable, sometimes moody, and if you get your period, you're again a little bit more cranky and all that. So this is what hormones come in. Again, you have thyroid, you have prolactin hormone having different impact, you have testosterone coming with a different impact on sexual life. So all these are actually gelling together to make something different every day.
Ma'am, when a little girl is born into this world, what are the how does her hormone cycle look like by the time she becomes an old woman and the cycle is fixed?
So basically when babies are born, especially girl babies, they have lots of eggs in them, and they have a very good confluence of their maternal hormones in their body. That's why when girl babies are born, they might have a little bit of white discharge, they might have a little bit of bleeding also because of maternal hormones, the influence of maternal hormones. All that weans off in some days, and the baby grows as such. So it's similar to a boy and a girl at that time. And when puberty hits, again, that's the time that your ovulation starts in. So first is breast development. Breast development starts somewhere between 9 years, 10 years. That was the usual norm. Now it is little early. But yes, that's the usual norm. And once the breast development comes, the pubic hair and the axillary hair comes in. And after that, when puberty sets in, you start your period cycles. Then comes the flow of estrogen, progesterone and all that. And that the vicious cycle goes on and on and on. So till she has a baby, and then she's again to her 30s, 40s, the cycles are the same. Once they hit 40, again eggs are done. They are bad quality eggs, sometimes release, sometimes they don't release. And when they don't release, they form cysts, they cause erratic cycles, they cause bleeding disorders, they cause thick linings. All these are very, very common. Perimenopausal, they are common. And when perimenopause comes in, because of the fluctuating estrogen level and progesterone level in the body, your bones might lose calcium, your skin might lose the glow, your elasticity decreases, your collagen decreases, your bone mass decreases, and the cardioprotective mechanism of estrogen progesterone, that weans off. So people might get diabetic, they might get, because of the excess weight coming into the truncal area. They also might get hypertension because of its positive impact weaning off, and because of the obesity that can come in and excess weight gain that can come in during this time, you can have a lot of fluctuations. And these fluctuations are so unexplainable at that time. They have so much of mood swings, loss of libido, very poor quality of life, and they have to be, that's the time when they are publicly active. Very, very active with their children, something or the other going on in their life, and that's the time the entire trauma sets in. So when post-menopause, the same thing increases and they have the transition. How smoothly you take it through is in your hands,
Yeah.
but you have to be determined and you have to be positive and you have to have discipline. That's the core.
You have told us about the estrogen progesterone. Just correct me. This is the impression that I have. If hormones were in a party, I would assume that estrogen is the cool, adventurous friend, and the progesterone is the not so happy drama queen. Am I right in the
Introvert.
intro?
Hormones generally don't ask for our permission when they do these shifts. So, what are some of the wildest changes that you have seen women go through in your practice during these changes?
See, a woman's life is like a roller coaster.
Yeah.
So when they are in the roller coaster, they're super happy in the first phase. They're super sad in the last phase. Once the period are about to come, then they are a little sadder, they have mood swings, they eat a lot and they exercise less. The body automatically shuts down.
Yes.
And this is something that women generally don't accept. But that is what happens. In some people, very mild forms. In some people, very, aggressive forms. And somebody who has the knack to manage their life, that's the thing that is the difference, that somebody who's excellent, somebody who's moderate, somebody who's a cranky female in the flock. So it's all about managing your mood, hormones, life and yourself according to that.
Okay.
What are the subtle signs that we should not miss? Like, for example, tell me what are the signs that I should look in, when I look into my wife or my mother or anything, wherein I understand that there's something wrong with the hormones and then that she needs attention, medical attention.
So basically, you have certain trigger points. Even in spite of you not instigating, something is coming back to you.
Yes.
Unwarranted,
Yes.
unintentional, and they come back to you saying that why was I like that?
Oh, okay.
I didn't mean to be like that.
Yes.
So that's something really men should take it seriously, and that's the time you should sit down and talk. Talking makes a lot of sense, and when you sit down and talk, you would understand the depths into what really was not her intention, how her emotions played a major role, and words just rolled out. Words are something they don't go back. And men are very bad at remembering those words and getting back to the woman again and again. You told me this, you told me that. But women don't intentionally do that. There is always a sense of something driving her behind, and she talks.
Yeah.
So when such things happen once or twice or thrice in a week, you should understand that there is really something wrong, and this is the time that you should seriously take woman's life into discipline, and you should help her out, whether buying you both a gym membership, or together working out, or together cooking, or spending more time and giving that comfort zone. And don't take women for granted. This is your job. No, you also do that job, so that she will not feel at the back of her mind that I am only supposed to do this, I am only supposed to do everything. You should never give a chance.
Yes.
So all these things are a point that you should matter.
Good advice, madam.
No, it all comes back to what Maya says. Communication is the key. Yeah. So we are right hitting the point there.
Yes.
Now that Suman has asked about her partner, generally men say are you PMSing or it's PMS, but nobody talks about premenstrual dysphoric disorder, PMDD, which is, how common is this and what happens?
Every woman actually has some degree of PMS or dysphoric disorder. Some have very mild, some have moderate, some have very severe forms. But whatever said and done, it's the fluctuation of hormones, and it's the influence of your lifestyle on your hormones.
Yeah.
Whether you have a good day at work, you will not have a single problem. If you are having a very bad day at work, similarly hitting a bad day at home, not able to sleep because of some chores, and you are having some kind of PMS, then definitely it's going to triple. And this is what is happening in every woman's life. Somebody who's comfortable, somebody who's on a regular chores, not stressed, having her regular activities, sleeping well, eating well, balanced food, not junk eating, not outside food, and not just sitting and watching everything on this earth late nights, because your sleep is the most important mechanism to put you back another day. So if you're not sleeping and repairing yourself, everything is going to be a disaster.
I would love to sleep no matter what happens to the world. I love my sleep.
You should also.
Yes, and there are so many studies that say that women who sleep adequately have lesser problems, whether it is mental problems, whether it is physical problems, whether it is cardiac issues, diabetes, anything for that matter. Women who sleep well, who actually stop eating early, by 7:30, 8 o'clock, if you retire off your food and you sleep early, that's the best way to keep your health, and also the best way to repair your body and recoup it.
I've read somewhere that women need sleep more than men do.
Of course, yes, and that is true.
Yes. And madam, hirsutism is also something that deprives women of the confidence that they carry. Tell us a little treatment options about when a woman is facing such a thing.
See, hirsutism is, it's a topic that is opposite of estrogen and progesterone. It's again an excess of androgens.
Yes.
When androgens come in, androgens act both ways. They act on your libido, they again act on your sweat glands, they act on your acne. You're more prone to acne if you have a lot of androgens. You're more prone to excess hair, the coarse hair, the harder hair, lengthier hair, and unwanted hair. Now, this hirsutism is an inherent property of increased androgens wherever it is. Androgens again are produced in the ovary, in the extrarenal tissues, the adrenals, and also in your fat to some extent. And these androgens influence all these what I have told you. Now, when it comes to excess of androgens, and there are certain other hormones that also influence this thing, and in conditions specifically like PCO, you have this excess androgens that are coming from the ovary, from the stroma of the ovary, where you have an impact, a target organ. Now, these androgens, they don't keep quiet. They have an impact on this hair, and when you have excess of this, somebody who's planning pregnancy, not planning pregnancy. Again, we have two categories of women. Somebody who's really not planning pregnancy, you have contraceptive pills which take care of this. Like we have cyproterone and all these combination pills, which actually decrease the hirsutism, especially on the face and coarse hair and all that. Over on top of it, if you assist them with good lasers, then the chances of decreasing and the chances of having a better skin outcome is very, very good.
Okay.
And sometimes even if you have coarse hair and you just go for lasers, they don't work because you're not addressing the main
root
problem.
cause.
Yes.
Yeah.
So you have to address the root cause and the main problem.
Yeah.
And in PCO, the main problem of excess androgens has to be addressed in a very, very professional way. You cannot give them 1 month and 2 months medications. It is 1 year or 2 years or 3 years. It is a long-term treatment. And if they are cosmetically not good, especially women, cosmetic reasons are something that actually act on their mood also.
Yeah.
So if you're not looking good, then it's a very, very negative thing for their mood also. They have low confidence, they worry a lot, and it's a trigger for them not being happy.
Yes.
So now it's every woman's, it's been made by the society that every woman should look good.
They should look in this certain way.
Exactly, certain ways, certain size, certain norms, all this is trash. But if it is real hirsutism that is a consequence of a hormonal problem, yes, you need to fix the hormonal problem. You cannot live with hirsutism because that's a problem. But when you're planning pregnancy, you cannot work on any of these.
Yeah.
So that's where is the real roadblock. You are having hirsutism, you are having obesity, you are planning pregnancy, you can't give anti-androgens, you can't give contraceptive pills, you can't go for lasers. So there are so many
things, and
whole lot of things.
I guess the woman has to be prepared to be the mother and be pregnant, including thinking about all of these factors.
It's her
Be very
bold decision at
yes.
that time.
Yes.
It's her bold decision at that time that there is a way out. Naturally planning pregnancy, lose weight. If you lose weight, take the help of insulin sensitizers, you slowly lose weight, you can get pregnant naturally, and when you're losing weight, your androgens decrease and your hair also decreases.
And now that you brought the weight topic and PCOD, the cycle of PCOD is caused because of my weight, but when weight is caused by PCOD, it's a cycle. This is caused by that is caused by this. How do I break the cycle?
Basically, PCOD is not a single factor problem. PCOD is always a multifactorial problem, and now we have seen that obese mothers, especially mothers who are overeating or mothers who are pregnant and not following diet and having gestational diabetes, can have a genetic imprint on the female baby to make that baby PCO in future. Along with the genetic imprint that the child can carry through the mother's eating habits, and there are so many thought processes also that influence these processes, and after delivery also, including not giving breastfeeding, giving formula, childhood obesity, increasing the amount of junk in the weaning foods, giving them processed food, not homemade food, overeating, overfeeding, because children nowadays have nothing to do. They're sitting in front of gadgets, and mothers won't change. They want to feed the children, especially according to the clock. Whether there is appetite or not, you have to feed the child because it is her intention that is working. So then childhood obesity, all these are causing lot of obesity, and if they have a predisposition for PCOD, as I told you, from the mother's womb, they will manifest PCO. And PCOD itself is insulin resistance, obesity, obesity, PCO. So that's the vicious cycle. When you really have to break this cycle, you have to tackle insulin resistance. So insulin resistance naturally can be tackled by exercise, by sleeping on time, eating well, balanced diet, follow the sun, get up early, sleep early. You can start your breakfast and then end by early evening. That's how insulin resistance can be taken care naturally. Think positive and no stress. All these things matter a lot. And this is only half part of it. Nothing can be naturally managed 100%. You can naturally manage all this only 50 to 70%. The rest has to be influenced by therapy. Now therapy is insulin sensitizers. Insulin sensitizers work beautifully to lose weight. And they actually make the insulin work. And when the insulin works, it's not allowing adipose tissue formation and it will burn the fat. If somebody is not taking insulin sensitizers, you work out, you go upside down. Nothing happens. They are very, very resistant to lose weight. You take the help of insulin sensitizers. It is not for lifelong that they have to take it. It is the initial kickoff that makes a lot of things work well, and it will churn down to results.
The initial push.
You should start there.
Yes.
Madam, is there something that you think every woman should know about hormones by the time they hit 30?
Yes, because every woman is the most busiest at that time. Okay, and they least take advice because their priorities are different. Somebody's priorities is career. They give 20 hours into the career and 4 hours into body repair. Now you tell me which woman is going to be healthy this way? Or else somebody is completely indulged into family, that she's not even sleeping 4 hours and working 20 hours for the entire family. Cooking, sweeping, mopping, whatever said and done. So women at 30 should think that what they invest in their 30s in terms of their health will be their returns at 50 and 60.
Wow.
It's like more than an FD, because for example, if I'm telling you, if you're investing in gold and when you're 30 years, and then at 50 years the gold gives you say into 6 times
Yes,
returns.
yes.
At 50, if you have a stroke, all that money will go for treatment of the stroke. So better don't invest in something that will actually be a bill receipt.
Yeah.
Okay, you invest in your health. When you really invest in your health, you'll be stronger at 50, you'll be well built at your 50, you'll be happier at 50, and really at 50 is some time that world gives you so many opportunities to travel, to spend time, because your kids are gone in their career, you have a lot of free time. At that time, you should never be sick.
Yes.
You should always be ready to travel or
Yes,
do whatever you love.
because financial freedom also
Yes.
you'll have.
Yes.
Because you always, everybody is planning for their retirement and how they want to do the retirement. You should never spend retirement in hospitals. So 30 is the right time to concentrate on your health. Focus on what you're eating, how much you're eating, and when you're sleeping, and are you taking your vitamins, and are you prepared to be healthy at that time? Live the moment.
Now that we talked about 30, there is this puberty is very bitter sister, the perimenopause. What happens in this perimenopausal phase? How should a woman be ready?
Perimenopausal is like a war field. Okay.
Nice references you're bringing.
It's like a war field. So you have so many things to do at that time.
Yes.
And your kids need attention, your husband needs attention, your job needs attention, and you are multitasking, and that's the time when your hormones are playing a lot of things, and you don't have time for all these things. Women are fed up multitasking at the age of 40, because they've been doing this last 20 years, from when they have actually, become a woman, and 20 years from there, they've really become fed up of what they have been doing their entire life. And at 40, when the hormones go up and down, your calcium is decreased. You are having so many other problems, sometimes extra bleeding that happens because of the thick lining. You're putting on weight.
The hot flushes.
Yeah, and all these hot flushes and everything. You're really upset of how you are and what you are and how you look and how you're managing things. Except for health, their agenda is everything else. So if your agenda is your health, you gym or you do your daily chores or you do gardening, you take your vitamins on time, you make sure that you have a less carb, more protein meal, and you have complex carbs. You make sure that you invest in something that is a stress management, whether it is art, craft, whether you go pamper yourself in a spa, or you do photography, or you holiday, or you sleep, or you take a shower, anything
Just
that
shut
actually,
your brain and let it not stress.
Yes, let your body relax. Let your body relax.
Yeah.
Otherwise, you're going to be pulled into the vicious cycle of trauma and managing the trauma.
Does menopause have to be the end of life, love, living, and libido?
Absolutely not. It can actually be a good beginning also. The second innings. So basically, women find themselves very busy once they get married and conceive, and it's all about childcare.
Yes.
So once you are in your perimenopausal group, you actually finish all your chores, attending to children, and they're settled and everything, and that's when your career phase is stable.
Yeah.
Even if you're working, you are into a good stable position. You have absolutely streamlined work hours, and that's really the actual time you can come back and kick in the second innings of your life. Because even men are ready for that second innings. They keep hunting here, there, everywhere. So it's always the way you think. Okay, if you think you're done, you're going to retire. That's how your body is going to respond. Everything will calm down, as if you've put, water on fire. Again, if you think that now I've finished everything, now I'll start experimenting with my life. That's when you can kickstart the fire again.
It's all in here.
Yes, it's all in your thought process. And women have been made to think from ages, I don't know from when, that activity in your life, especially sexual activity in your life, is only up to a certain age. But it's not like that. It's absolutely not like that.
Ma'am, this because we menopause and all, there is a lot of knowledge or too much of information on the internet about hormonal replacement therapy. But can you give us clarity on who should start it and when should they start it?
See, basically, Indians usually might not need such an aggressive form of treatment on a regular basis. Yes, there are special situations and there are situations when they might need it, especially when they have premature menopause, you have premature ovarian failures, lot of fertility treatments and you're exhausted and you are going through menopause or surgical menopause when you have got your surgeries done and your ovaries are failing, hysterectomies and all these things for various reasons, then you really might need some hormone replacement in one way or the other. Otherwise, if you have a very smooth transition to menopause, only adequate supplements and dietary changes are enough to get that smooth transition. You might not need hormones. But yes, all said and done, there are a lot of fluctuations in science. Women in competitive roles and women who need a lot of thinking power, concentration, and who are not able to focus. Sometimes there is fogging also in menopause. It's not only about sexual needs, it's about your lifestyle that is also getting impacted because of your hormonal changes. So if you need to focus, if you need to have that good thought process, you cannot have anger spells, you cannot have hot flushes in front of everybody, then there comes the need of using subtle agents that are really going to give you smooth transition. It is not going to be forever, but yes, you will need that period of time for recovery. And women with a lot of problems in bone and skin, you might have osteoporosis, you fall and you fracture. That's when you don't need only calcium or vitamin D. You'll also need a comprehensive therapy if your hormones are less, some supplements that will help you, aid you and make you that recovered person in a better way.
Madam, it's so important. I see here whenever, like you mentioned, when somebody has a fracture at that age, I don't see them visiting a gynecologist because that angle itself is not explored. All they do is go to the orthopedician, get a putty done and then wait for it to heal and pop on calcium tablets.
Yes, they try to fix the bone, but we tell them to try to fix the body first. That's very, very important, and that is a very crucial part of how you manage women at that age group. Women at 70 need not be given hormone replacement therapy. If they fall, if they have a fracture, then orthopedicians are good at doing what they have to do. But women in 40s, they fall and they have a fracture, 50s, they fall and have a fracture. There is a component of gynaecologist and gynecological care that is needed and has to be addressed simultaneously.
I think it's the lack of knowledge also, Suman, and not many talk about it, the importance. Like when I remember one of my aunt, she was just lifting her leg to put on a higher table and then fractured, like a eight crack.
No, that's the condition right now. That's the real scenario right now. No woman is getting exposed to sun because maybe she's working indoors, maybe they have over drilled their brain saying that sun causes tanning and tanning causes pigmentation. That's the true essence of what women are carrying forward. They completely cover themselves when they are in sun and they use a lot of sunscreen. All these things are not absorbing the required vitamin D into your skin through your actual way it has to go through. and neither do they take supplements.
Yes.
Now, there is no clinical exposure, there is no supplement, then what will happen with the bones? When there is no vitamin D, there is no calcium absorption. When there is no calcium absorption properly, then your bones are going to lose the calcium, especially when you are perimenopausal, there is deposit mechanism lesser,
Yeah.
and it is removing for regular usage. So there is bone loss, and also you not only do this loss, you also facilitate that loss. You try to lose weight at that time and you go on erratic diets, low on calcium intake, low on vitamins, and you lose the fat also, which is actually trying to give you some estrogen. And not only women, now this is the norm with young population, they are not able to conceive with the loss of master hormone, master vitamin, vitamin D.
There's a lot of debate happening around menstrual leave. You might have seen a lot of patients in your OPD wherein while having periods, they might be having debilitating pain or would have been having a very pain-free menstrual period. What is your take on menstrual leave?
So basically, women from don't know when ages, okay, they've been having that menstrual leave in one form or the other. Because they have to facilitate them with some kind of comforting things, they are off the kitchen, they are off the daily chores, they're off the temples, just to give them that extra time to spend, recover and recoup and take care of themselves, eat, sleep and relax, so that the blood loss and all these things that is happening around her, the hormone changes and everything are taken care all by herself in her comfort zone. Now comes when women are actively in different places, working, going in challenging roles and everything, and the stress that is adding to all of these, and lot of irregular food patterns and obesity and endometriosis, fibroids, adenomyosis and all these things, they are having issues in menstrual cycles where some women, not everybody, some women need help.
Yes.
In terms of painkillers or restriction of activity, resting and taking home remedies, and also taking off from office, because they are dealing with a cumbersome affair and pain is super hero there that will not allow you to do anything. When in pain, you cannot take good decisions, you cannot do your daily chores, you cannot be active. So there comes the need of menstrual leave. But every woman has the chance to treat their problems, naturally locate where the flaws are, improve her health, control all these things and get back to her normal self. She need not take leave as such if she is having normal, regular cycles, which some women do advocate for. Why should I? I am all right. For some of them, nothing is required. But for some who are really suffering, having a lot of issues, and they should be offered this because they should not suffer, as such. So menstrual leave is good for somebody who needs it, not needed for somebody who don't need it. So it's all a matter of policy that they have made. Government of India, I think, has also made a policy to give leave for certain 2 or 3 days a month to facilitate this. Policies do come. Who needs it will take it. Who don't need, they need not take it.
Madam, when it comes to libido, what are the hormonal changes that cause the desire to, desire being lost even in a very loving relationship?
See, relationships are the lot of relationships, okay? And when you talk about committed relationships, monotony can be one destruction killer for libido. Monotony, daily life challenges, financial transactions and financial stress, strain kills your libido. And stress anywhere around, even a single person, will kill that person's libido and the partner's libido also.
Yeah.
Because they have to have reciprocate relationship and reciprocate each other in their own good and bad times. So more than medically, okay, it's the surroundings that play a major role. And for somebody who have very beautiful surroundings and no stress wherever possible and everything taken care and they're very loving and everything fine, yet the libido is less, then you should think that it is hormones, low estrogen, low testosterone, and it can be perimenopausal.
Okay.
It can also be at times very low vitamin D and B12.
Yeah.
These are two super vitamins that actually govern your sexual health also.
Yes.
As a man, I know that I work on a 24-hour cycle, whereas women go through a 28-day cycle.
Also.
Also.
Yes. Along with the 24 hours circadian rhythm, they have a 28-day cycle.
So could you tell us how the mood, energy and libido go along the cycle?
So basically, men have a different cycle and women have a different cycle. Okay, men, if you talk about men, they have more libido in the early mornings. Okay, women have great libido at the end of the day. There's a mismatch here. Then they have to definitely compose and make sure that they sync each other. Women have early morning several chores that they have to complete. They cannot afford to be busy at that time. And women retire for the day, but men have other interests, vested interests at the end of the day, and they have a better libido early in the morning in their sleep. So there is a mismatch here. And the 28-day cycle, once 1 week is gone for the periods, the after 1 week is very enthusiastic, high libido and very good. And the next 1 week is also good libido and good activity and they are enthusiastic and everything. The last 1 week is very bad libido.
That's when men need to go on holidays.
Yes, no, it is not about a holiday. It is about supporting your wife in the last 1 week other than the menstrual cycle week. Because that support will make sure that your next three weeks are smooth. Otherwise, you will be killed. Okay? So, it is very, very important that the premenstrual week fluctuations, lesser libidos, mood swings, and they can have little bit of dietary changes, sleep changes, thought process changes. So, you should never be a trigger point.
Handle with care.
Yes, handle with care, handle yourself with care.
handle
Nobody
with
needs
love.
to handle a woman, but you need to carefully handle your words and your support.
Point noted.
Do you think women are getting the full picture while using the birth control pills? How does these birth control pills have effect on their body, mood and libido again?
Birth control pills were actually very high dose pills.
Yes.
In the past, say if you go 50 years back, then you had a very high estrogen birth control pill. Slowly they've understood that the estrogen can have a lot of side effects and they started tapering down the estrogen component. And once they started tapering down the estrogen component, now we have ultra low dose birth control pills. And then they started experimenting with the changing progesterone component also, because certain component was not working certain way and certain estrogen was not working certain way. So there came birth control pills for different options. Like PCO, you have a different birth control pill. You have a cyst, you have a different birth control pill. You have endometriosis, you have a different birth control pill. You have only contraception, you're low weight, you have a different birth control pill. You have PCO and overweight, you have a different birth control pill. But whatever said and done, your original mechanism of estrogen, progesterone is all gone. So you will be on a pill that will drive you, whatever said and done, you're on the pill and your exact body, all body functions will be on according to the pill. Some pills are 21 days, some pills are 28 days, some we give for 42 days, some we give for 63 days for different reasons. So when you're on the pill, so it's not like all your bright self 1 week and all your low self another week. You will be stable. But again, when you're on the pill, you should really work on your emotions. You should work on your sexual life because you might have some fluctuations here and there. They say, but what books say, patients feel because they study that. If you're not given an information about what you might feel, you'll not feel anything.
Don't do Google.
Yes.
No ChatGPT.
Whatever the Google says, they try to figure out and find it. Even though it is 1% of the people who might have it, every 100 to 100% of them would try to figure out whether I'm having this, whether I'm having that, whether this is there in my, side effects. It's not like that. Previously, none of the patients would knew any side effect profile. They were all cool, all going normal. If they had a side effect, we would register that and we would either change or supplement it. But now, since people are trying to figure out side effects, they would even match the spurious effects of some other indigestion also to outside food to the contraceptive pills. Okay, they binge watch the entire episodes, 20, 30 episodes of 3-4 seasons, 2 days, and come to us saying that they have intractable headache because of the contraceptive pill. I have seen women who have manifested thromboembolism because of stagnant lifestyle and this binge watching, and they've attributed it to contraceptive pill. Thromboembolism is such a huge problem. Already if you're obese and you're statically watching one or the other thing, not mobilizing yourself, your lifestyle itself will give you a clot somewhere and it will travel anywhere. A contraceptive pill also has an attribute that can give you clot in some instances, but this will double and triple the chances. So if you are active, if you are happy, if you are maintaining your health, if you are good, sleeping good, no other issues, your pill will never cause any problem. At the most, it can cause is some dryness here and there, which is manageable.
Yes.
Good foreplay, you will manage everything. So it's not about how you perceive things the wrong way. We doctors tell you we are there to help you out, and you should perceive things in the right way. And consistently, if you're trying to think negative, everything will manifest negative in front of you. If you are neutral, you will actually see the real scenario.
Ma'am, if a woman comes to your OPD and says, I'm not feeling like myself, where do you look hormonally?
We actually try to talk to her and address to her problems that she is not able to correct. There are some correctable problems, there are some non-correctable problems, but all by yourself. Now, correctable problems are like what I've told you about the diet. If she's not on a proper diet, we help her with it. We supplement her with the required supplements. We do test her for vitamin D, B12s, and her hemoglobin levels and all. And this is again, in India, we have a lot of women with anemia. So they have this brain fogging whenever there's low hemoglobin. So these are some very, very peculiar points that we need to check. And also, we also figure out whether she's sleeping well or she's exercising or how is her work schedule, is she too tight in her schedule and all that. When everything is perfect and she's still not herself, then definitely we would check her hormones like her FSH, LH, her estrogen, progesterone, her AMH, her thyroid, prolactin, and testosterone. So all these are checked, and all these are synced to a point that is she losing certain hormones, or are all the hormones good and there is something else to it.
Okay.
So most of the time, if there is any hormonal ups and downs, they're all correctable. But if there are any other emotional problems, women do have emotional problems, and one manifestation of her deep emotional disconnect with the family or the workplace or her troubles can manifest her being unwell and not being herself and all that. That is how we discover medical, non-medical. Medical, yes, we treat. Non-medical, we have excellent counselors who can go to the problem, the root of the problem, and address to it. But definitely she would need help, and every woman has to come forward and talk to us saying what her problems are. Unless and until they talk to us, even we are helpless. And trauma is something that no woman should face. Especially women are trying to climb into so many places, so many heights, But what about their own self? What about the trauma that they are keeping in themselves, saying that they don't have time or they have other chores and other attentions and somebody else is there that needs priority? No, stop being so foolish. They have to be smart. They should understand that world runs on their services and their presence. So it is important to keep up to their health, well-being, to be a better person for others.
Learn to prioritize themselves.
Yes, definitely. And Indian women never do that. They never do that. They come to us on the verge of deathbed. Educated, uneducated, rich, poor, affordable, unaffordable. They come to a doctor only just before every possibility is done. Still we are, running behind screening programs. We are running behind diagnosis, early detections and cancer screening programs. All these are not happening because women are not prioritizing themselves. They're so busy in their life that they stopped understanding that they also exist.
And not just that, I feel even with my friends and all of them, when I tell them, why don't you just go talk to a psychologist instead of, you're going through so much, just talk to a psychologist once. They would like, that problem has already crossed, so I think I will talk about it later.
In India, psychologist and help for therapy is still not picking up.
Yes.
It's a big taboo. They don't even go to a doctor facility for help, leave alone psychologist. But what education is teaching them, I don't understand. If education is giving them excelling in their career, reaching highest points, competition with men, earning, being that 50% that you want to be at par with men, you have to have an extra thought about being healthy also. And mental wellness is the most strongest point of health.
Yes.
And if you think that you are going to neglect that point, you're utter failure. You become prime minister of any country, you're mentally unwell, you're not the right person for the right post. So being a mother is very responsible post. What you're teaching your children is also important. If you teach your children that you are not a priority, tomorrow they also become like that. India is becoming like that. So as a mother of a young child, you prioritize your health, your wellness and your life, and you say that these are my boundaries and this is what I keep for myself. These are my timings and this is the way I'm going to be. Tomorrow they will also learn that.
Yeah.
No mother is teaching their children to be happy herself,
yes,
so that they will be happy by themselves. Yeah. They are just in the rat race of work and finish the day and do something for tomorrow. Where is living in the moment?
Yes.
There is nobody that is encouraging living in the moment, living happily, living by the essence of your own content.
Like we always say, first be intimately with your own self,
Yes.
and then
Love
the whole
yourself.
family is
Yes.
so lovely. The environment, when you be intimate with yourself, is just a lovely
You
energy.
love yourself, you're happy yourself, you'll radiate happiness 100 times.
Everywhere.
Yes.
So everybody around you is going to have that aura, and you share that beautiful, happy aura. Your children, your workplace, your home is going to be heaven.
Ma'am, sorry for this, but we have been stalking your Instagram profile and we have found something called 21-day infertility program. Can you tell us everything for our viewers about this program?
So basically, I had my first child through IVF.
Okay.
Because I had a very turbulent fertility treatments and all that, and after 3 years of fertility treatments and multiple IUIs and everything, I didn't conceive, so I had to go for an IVF. I conceived through an IVF first attempt. I had twins, but I had a preterm delivery. So that's when I changed completely, and then I thought that my environment and its influence on my fertility and childbearing capacity was too much at a strain, running behind profession and other things, and hitting the wrong corners. Then we entirely transformed our life. So starting keeping boundaries of work, and then organic food, time spent well with the family, and resting and recouping and making sure that you are physically, mentally also taken care of. I unintentionally conceived my child, the second pregnancy, at the age of 39-40. So at 35 I had an IVF failed, at 35 I had an IVF failed, at 39 I conceived naturally. Then started my journey with natural pregnancy planning program. So whatever changes that I did in my life that improved my fertility, I preach only that. I preach that, and that's my entire agenda, that 95% of the people can conceive naturally, only 5% need assistance, and that 5% will need the right assistance only if this 95% is taken care of.
Yeah.
So that's how the concept of 21-day natural fertility program has come in, because you cannot teach any of these in a 20-minute consultation or a 2-hour consultation or a 2-day or a 20-day one-on-one sitting. It needs a lot of other things that have to be taught, addressed and incorporated. And of late we have even understood that it cannot be done in 21 days. We have made the program 3 months natural pregnancy planning program, where the couple is given daily chores, daily goals, lifestyle changes, diet, fitness, even assistance in how their intimacy should be, all these things. And with this program we are doing wonders, and this program is going great because it's a complete holistic way of achieving the pregnancy through complementing your healthy life. Your health, your partner's health will together give a healthy pregnancy. Those healthy pregnancies is what I deliver, so that the chances of having a natural birth is too high.
The couple gets to be healthy as well as also conceive naturally.
So this is like choosing your reproduction the right way. And in this rat race where instantaneously they want everything including pregnancy, they keep trying for a month, only a month, and they get disappointed. But they should understand a point that fertility is judged over 1 year. Your chances of having pregnancy, if you have very regular intimacy, is only 60 to 70%. And that too if you are healthy and if your hormones are all in place and if your intimacy levels are great. That means at least thrice in a week if you have intimacy. So there are so many things to it, but people rarely understand. They understand things only when they have a priority for it.
Ma'am, have you ever encountered a patient in your OPD wherein you felt like, wow, that we really need education on hormones to these people? Any situation like that which is...
When women suffer in silence, they have shouting spells, yelling spells. When the children get them, my mom is not herself.
Okay.
She's just simply shouting on us every alternate day. And she's even pissed off even if we don't reach home within half an hour of the time, that even if it is delayed. This was not her couple of months back. There is something really wrong. And previously she never used to cry. Now the crying spells are too much. And she's not communicating. Of late she's silent and she's not coming to family get-togethers and all, and she's not getting ready the way she used to get ready, and she's obsessed with the way she's looking, and she's always eating one crash diet or the other. All these things kids know these days because they're educated. They are taught in schools, they're taught online, they are taught everywhere, and their core friends, parents might also face the same thing. So they talk amongst themselves where to go help, how to take help and all that. They're getting. So previously only husband used to get them, or their mother or somebody used to accompany them
Sister
and
and
tell us that this is what they're facing. But nowadays children are very proactive because they are at the receiving end and they don't know why those things are happening. So they are coming.
So with all of this increasing work and financial independence and all of that, this phenomenon of clock is ticking.
Yes.
And then can you tell us all about this and also about the egg freezing? I would call it a business right now.
See, more than business, it is the need of the hour.
Okay.
Because women have a greater power to make difference in workplace. any workplace where women are leading or in leading positions, they give their 100% because of their capacity to multitask and also their capacity to streamline and give that compassionate care, and also to get most of the departments together and make sure that they work with efficiency. They are given leadership positions in so many places. Wherever they are kind of given major roles. In such given situations, if that woman is not able to give priority to her own reproduction, then what is the choice? That's why there are several companies that are funding such women to make sure that they freeze their eggs or embryos if they are in committed relationships for their future reproduction. And it is the need of the hour, because rather than having children at a later date where they can encounter problems, genetic problems or whatsoever, only because of the aspect of aging, you can freeze your eggs or embryos when you are your younger self, and they will have lesser complications, and you will have a younger aged child at whatever age that you want. And people think about so many securities. They want a car, they want a house, they want bank balance, they want shares. It's a similar kind of thing. You have your reproductive security in a vault. And this reproductive security in a vault, you can use it any time till you're 50 years. Because I think now we have the IVF, there's a bill and all that where there are age restrictions. So you can use these eggs whenever you're ready, you're prepared, or you're okay. At that time, depending on your medical fitness, these frozen eggs can be used for pregnancy. Now, every woman out there who are not able to give time for reproduction, childcare, because now childcare is not only about pregnancy, it's all about giving that child a good, bright future. So when it comes to good, bright future, there's so much of competition, there's so much of financial aid that is needed, so much of expenditure that is coming. If women and families are not secure in that way, they would definitely not want to prefer getting a child and leading a compromised life. So it's their choices.
And also, it's not just about the professional growth and all. Not meeting the right person also. No woman wants to deal with stay with the wrong person, have kids for all the wrong reasons that the clock is ticking, rather than she would choose this, find the right person and then have the
That's
child.
why we have an option of egg freezing and embryo freezing. Yes. And this is something called as women empowerment. There are so many faces to women empowerment. Whether you talk about finances, whether you talk about choices, whether you talk about having children, not having children, whatever said and done, this is one type of women empowerment where the decision should always be on the woman's side.
Yes.
Because it's her life and her commitment. Sometimes men, whatever said and done, men would not fall into so many criteria where women are needed. And we have to compulsorily take that point, and we have to respect that. Rather than pushing all old Indian mentalities on a woman's life, we should respect their choices, because it's a different world, and world cannot stop for her pregnancy. Her office parameters won't stop for her pregnancy, and still women are treated differently when they go on maternity leave.
Yeah.
Even though Government of India has given 6 months of maternity leave, I see so many women in challenging roles where they have to go back. I went back to work in 4 days. The first delivery, 2 days. Because my children were in NICU, I didn't have anything else to go back to work. Because I found my stress management at work. Otherwise, simply sitting at home and thinking about babies in NICU is horrifying. That time I hit the office back in 2 days. Once I was discharged, I went to the nursing home where I was working, and I worked. And when my son was born, I was already in a challenging role where I could not take a lot of break. So I went back to work as soon as possible. So there are situations where we really have to think about our surroundings, our commitments and all that. And Every woman should be given a choice whether she wants to become pregnant at that time or not. And every man, whether being a spouse or a father or a chairman of the company, should think that they are also born out of women, and they should respect women for choosing pregnancies and still making the world go on. Otherwise, what would they have companies for? They would not even mint a single rupee without women delivering babies for their future. So the future is entirely dependent only on women. So let's respect women for their choices, give them that single comfort zone, at least 6 months of maternity leave, so that they go with a committed role, they finish with happiness, they set their responsibilities, have a checklist and come back to work. And they will come back with a bang and they will give their 100%. They will never do any injustice anywhere whatsoever.
Madam, tell us one advice for women to make sure that their hormones are all maintained at an optimal level.
It's definitely taking care of the physical health. If you are strong with your physical health, that means you have stronger bones, stronger body, good muscle, good fitness, your hormones will be in place. That means you will have good sleep. That means you will have good hormones. So you should invest all that you have, whether it is money, time, intention, anything, in keeping yourself fit and healthy. So if you're fit and healthy, rest all around you is taken care. Health definitely means both physical and mental health together.
Everything comes back to be intimately you accept yourself physically, mentally, emotionally.
Yes.
Madam, before we wind up, we have some fun rapid fire round that we'd like to shoot on you.
Ma'am, to start this round, I have something called hormone or hype. I will throw out trendy hormone related claims and you let us know if it's a real science or an internet fad. The first one is seed cycling can balance your hormones.
Definitely.
Oh, we should all try doing seed cycling then.
It works wonders.
Okay. Hormonal birth control causes infertility.
Absolutely not.
You must detox your liver for better estrogen balance.
It's a fad.
Oh. Eating yams increases progesterone.
Not always.
So, madam, this is this or that hormone edition, okay? Estrogen or progesterone, who's the bigger diva?
Progesterone, no. Estrogen. But if you want pregnancy, it's progesterone.
Choose your want.
Choices matter.
Libido dip, is it more mental or hormonal?
Mental.
Premenstrual syndrome, is it a reality or a fad?
It's a reality.
Ma'am, I have one more lightning round where give us suggestions of what we have to do. One food, one habit, one attitude shift you swear by for a better hormonal health.
Invest in your health.
What's something about women's health that gives you real hope these days?
Attention.
I love this answer, ma'am. And last but not the least, where can our users find you, follow your work and slide into your DMs with their questions?
I'm there all over. But yeah, practice at a single place called Kim's Cuddles Kondapur. And I have an app on my name, Dr. Shilpi. And you can catch me there, online appointments for anybody outside Hyderabad. In Hyderabad, I'm at Kim's Cuddles. And I do track my DMs on Instagram. And not for quick consultations, but yes, you will get help there if you have quick doubts. And yeah, that's...
Do let us know if you want us to get ma'am to talk on some other subject. We are happy to have her in our studio.
Madam, thanks a lot. It has been a dynamite conversation. And if we miss something, you can sure reach out to us on our handles, Instagram handles. And before leaving, don't forget to like, share, and subscribe.
Thank you so much, ma'am.
Thank you so much, madam.
Bye.
Bye.
Bye-bye.